here to talk about an article that, a case report that I saw with one of the residents in our resident education clinic, and basically talks about a hiccup-like phenomenon that occurred as a consequence of abandoned pacemaker leads that went through the diaphragm. My name is Dr. Allan Aksamit. I'm a neurologist here at Mayo Clinic and have some long-time status on the Mayo Clinic staff. Been here, this is my 40th year. The article is entitled Intractable Positional Hiccups from Transdiaphragmatic Cardiac Pacemaker Leads, and it tells the story of a patient that I saw with one of the residents, Dr. Reece Hass, who I want to compliment for his initiative and stick-to-itiveness to both recognize the novelty of this situation and also see it into publications. So with regards to the article itself, the patient came to us with a complaint of intractable hiccups that had been present for a number of years, and it had become very limiting to his activities. He had difficulty inspiring a deep breath. He had formerly been active, playing softball with his local team, and found that now exercise or simple activity, anything that required exertion or increase in respiratory rate, would induce these, what he called hiccups, which were this involuntary ability to take a deep inspiration. And he found it very limiting and also causing him significant shortness of breath. Specifically, the patient's neurological status was normal, but when we inquired further about his past medical history, he had a history of having had transdiaphragmatic pacemaker placed in the 1970s for congenital heart block. That technique, as I understand it, is no longer used, but it intrigued us because of the idea of how pacemaker leaks theoretically could irritate the diaphragm and might be a potential cause for his problem. He had a pacemaker that was active and working, but it was disconnected from the old leads that had been placed in the 1970s, and he had a more modern pacemaker that drove his heart at the current time. So we tried to do a series of investigations. The most interesting one was the sniff test that we did with him, and that was something where he took deep inspirations, and what was noted by radiographic recording is that there were involuntary elevations of the diaphragm in an abnormal fashion that is not consistent with normal physiological movements. Again, something that would suggest some irritation of the diaphragm by some means. From a neurological viewpoint, there's a number of things that can cause diaphragmatic difficulty. Most commonly in the central nervous system, it's in the brainstem. Sometimes, though, it can be in the vagus nerve. It can be also in the phrenic nerve. Any of those things that irritate those nerves can cause this problem. But his anatomy was not such that any of the hard wires that he had as remnants of his prior pacemaker, going from the abdomen into the chest through the diaphragm, was in any way interfering with any of those functions. So it was a unique situation. We were further intrigued by the situation when we shared his case with one of our cardiology colleagues who thought that the patient's pacemaker leads had nothing to do with his symptoms. We had sort of a disagreement about what would be the cause, but we thought that there was such an obvious association between these pacemaker leads being through the diaphragm and his symptoms, we thought we should take it further. So again, because we saw these abnormal movements with the sniff test, we asked our cardiothoracic surgeon colleagues to take a look at the patient. They were willing, and indeed at a later date removed the pacemaker leads through a partial thoracotomy. The patient was in and out of the hospital in about 3 days, and he tolerated the procedure very well. And immediately after the operation, he tried taking deep breaths and doing other activities and found that his symptoms had completely resolved. abandoned pacemaker leads that go through the diaphragm theoretically can cause this problem with these involuntary contractions of the diaphragm from irritation. It can be a long time between the time when the pacemaker leads are placed and the time when the symptoms actually begin. His was about 4 or 5 years before we saw him, and again, decades after the time when his pacemaker leads had been placed and eventually abandoned. I think it's a matter of persistence and putting things together and recognizing that we all disagree about things sometimes and can sometimes benefit the patient by being persistent in our pursuits of our synthesis of the problem. So please feel free to take a look at the article. It's published in Mayo Clinic Proceedings. It'll be in the April 2026 issue, and you can learn more about the details of the patient's history and how we were able to try to help to solve the patient's problem.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings. Or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.